got hit really hard. Now we're looking at dollars coming in. It's spread much thinner. There aren't nearly as many dollars overall as there were in 2006 to be used in this area.
Yeah, and it's that complexity of the situation itself, which lends itself toward the mental health issue, which kind of compounds the problem a little bit, because people are frustrated. They're upset. They're angry. They feel powerless at times to take care of things, and they need somebody to talk to, really, and that's going to help them, restore sanity. Restoring sanity is one thing, but then also having the confidence in themselves to move through the system, right?
And that's what Project Renew is, and the crisis counseling programs across the state are based on the premise that people are resilient and they will get through it, and they might just need a little bit of help. They might need prioritizing. I have so much to do, I don't know what to do next. So the crisis counselor can sit with them and say, well, let's look at what's the most important thing to get done first. What do you think? We can link them up with services that the case management is a huge resource to use, because if they have any unmet needs, then they can get the help through the case management services. So that's how it's been working.
One of the most difficult things in all of this, working with Project Renew, working with case management, and working with a client, is that the recovery is really the clients. The recovery is the survivors. So what end do we come to where we say, we'll do this much, we'll do that much, and we try to help them and get them boosted, get them so that their momentum starts moving towards recovery. Initially, it may be a lot of hands-on for case management, it may be a lot of coaching along, and a lot of visits from Project Renew just to hear the story over and over again. But then you're hoping that they'll pick up and they'll start to move forward with their recovery because it is theirs. They own it. They're the ones who are going to be living with it long after we're all gone.
So if we have a viewer today who's looking, feeling a bit overwhelmed, and they need to, really get on track, how do they contact you, Kathy?
Well, the Project Renew, they can call me at 595-9363, or the Renew number. Something? I don't have that one memorized.
There it is on the back.
There it is on the back of the brochure. It's 607-595-9376.
And it's there on your for a viewer. It's right there on the show.
Yep. And then we have you can email us at renew@yourmha.com.
All right, very good. And we'll show that again toward the end but I just wanted to get it out there because you guys are doing an amazing job, seeing an amazing amount of people, and you should really be commended for the work that you're doing. It's tough when you're dealing with people who've been through tragedies in their lives, and when we have such a large population of people. I mean, it can get overwhelming even for the caregiver, and so it's great. It's great that you guys are doing such a good job with those people. And
thank you.
Yeah, I just want you to know that we really commend you for that. And Greg, when we're looking at this situation too, we have, in some estimations there's between 4 and 14 million in unmet needs in our community.
Yep.
We have $800,000 raised roughly from United Way, maybe when you add Catholic Charities and Broome County Council of Churches into the equation, you may have a little over $1 million.
Yep.
That's been raised to try to address that unmet needs. What are the plans from COED to kind of stretch that?
Well, one of the big things is using bulk purchases whenever possible. Unfortunately, right now we're having a difficult time finding a warehouse to house a lot of those bulk purchases and spread out. But we are working with local merchants to try to get discounted pricing on many items so that we can try to stretch those dollars. But one of the biggest ways we can do that is using volunteer labor. And that's where the faith partners come into this. United Methodist Committee on Relief, Mennonite Disaster Services, Presbyterian Disaster Assistance. They have experience in this, and we gained experience in running volunteers in 2006 right through 2008 when we shut down that program. So if we can stretch it, because every volunteer dollar is worth $20.85, every one of their hours. So if we can take that and we can bring teams in, and we've already got teams signing up to come in throughout the entire country, as well as the individual volunteers that are coming from SUNY Binghamton and many of the SUNYs throughout the entire region.
Well, and SUNY Binghamton's been huge so
Huge,
far through
enormous,
the
just in the cleanup aspect. The hundreds of volunteers that have come in through them just in the cleanup aspect, and they are willing to put on the Tyvek suits and the masks and the goggles and go in and clean out, and some of them are a challenge to clean out. So if we can stretch the dollars through volunteer labor, through bulk purchases, then we can help more people. And that's the critical part. We have to stretch what we have, because with estimates between 4 million and 14 million, and it's difficult to tell. It's really difficult to tell. Obviously, even on the low end, we don't have enough money to really cover all the unmet needs that are coming our way.
Yeah, and so in this situation, as opposed to in 2006, there was money for paid contractors.
Right.
And so now we're really having to do some thinking as far as how do we get enough skilled labor, as well as just bodies, volunteer people. So if a person wants to volunteer, they should what should they do?
Oh, their best bet to volunteer is call 211. Get right into the volunteer system. Let them know we're looking right now for skilled labor. That is one of our things. Is we're looking to go to the rebuild phase. We're in a transition. And that doesn't mean that all the muck out's done. It doesn't mean all the tear out's done.
No,
but
we're going to have
transition.
mucking out even, in the spring probably.
Yep, absolutely. The last house that I worked with a volunteer team on to muck out after the 2006 flood was in November of 2007. So they're still out there. And we'll still utilize volunteers to do that with, and that's something to think about. But we are transitioning now into the rebuild phase. And we'll still be able to hire professional contractors. It's going to depend on the magnitude of the task, the availability of the volunteers, and how many jobs we end up spread around. So we will be working with opportunities for Shenango and First Ward Action Council, as well as Tioga opportunities, to try to get good quality work done at the best possible price so we can stretch these dollars out. A lot of times we'll actually partner up with, say, First Ward Action Council. They may have a grant that comes in and handles a certain amount of things. We take and we say, we'll handle the flood aspect of that. We'll fund that. Now you can do a whole package for a household and help the people out that way. So that's kind of what we're looking at right now. And it is a complex system all the way around.
Right.
It's disaster. None of this is easy.
No. And what are some, Kathy, when you start looking at a volunteer who's coming into a situation like this, they see the devastation that's been going on in the community. They're not accustomed to that themselves. What are some of the things that they should be paying attention to when they go into these houses?
For themselves, they need to take care of themselves. They need to know their limits, and they need to have somebody to talk to themselves, somebody that will listen to them and hear what they have to say. Self-care is very important for even the crisis counselors that are going into these homes every day, and the volunteers that are seeing things that they haven't seen before. Is you really need to take care of yourself and not let yourself get run down. Make sure you stay hydrated, make sure you eat well, and stay strong physically and emotionally.
And the other thing is that some of these families that have been affected by this, they have children, and the children are displaced and other things. What are some of the things that we should be thinking about as far as the kids that are
okay? If you have a child, lots of times children don't know the words to express the feelings that they're feeling, and some of the things that you can do to help them get through that is to draw a simple feeling on a stick figure face with a simple either a smile or a frown, and ask them to identify it and tell them, ask them, how do you think that person's feeling and why do you think that? And you can start different conversations just by having them look at the different expressions on a stick figure's face. Give them the words, help them to express their feelings. That's really important because they don't have the words to express them. is what happens
Right,
often.
right. Yeah.
And older children that might have more language, you can do, hopefully have more language, you can have like a worry box where they can write down what they're concerned about, and you could put it in the box and they like pick one out, like at a certain time of the day, pick one out and have a discussion maybe at the dinner table or before bed about a worry that they might have. The whole idea is to let people know that what they're feeling is expected. And it's okay to feel that way.
Right. And the kid is no different from that.
Exactly.
And kids need to trust their own feelings and trust their own thoughts in the situation. And some of those kids are going to want to be involved in recovery. They want to help their family move back into their house. They want to be a part of that process. And so I would imagine you want to help them, encourage them to
exactly
do that.
And for the children that lost their schools, I know several of them that brought in books from home because their library was gone. So where they were now have class, there weren't books just for reading for pleasure. So lots of people brought in books like that. Encouraging children to do that and be involved and do as much as they can it helps make well-rounded people to begin with when you're doing volunteer work like that. And this is the perfect opportunity for younger children and older children to pitch in and help too.
Yeah.
I think it's also important to remember that we're all flood affected.
Yeah.
So there might be a kid who's
That's true.
Living 2 houses down from somebody who was flooded and they weren't flooded themselves. They may want to get involved. Every one of us has been flood affected by this.
Definitely.
And we really have. And can we show that clip again, just how a person could get in contact with Project Renew? This is an important number for a flood person.
Absolutely.
A person who's been affected by the flood to contact them and to make sure that they get that information out there to people.
And we have to make sure we're supporting Kathy
Yeah.
and the case managers because they have a difficult task on themselves.
They really do, and it's it's tough because they're having to deal with some very complex emotions from people.
Yep.
And as do volunteers, as do the groups that are trying to help them through the whole situation. I can't imagine the magnitude of this issue.
Yep.
But anyway, well, Greg and Kathy, it's been great having you on Encounter
Thank you.
today. We're very pleased with the work that's going on in this community, and I hope you, our viewer, at least got some education as far as what you can do to help with the process of recovery as we move forward. Thank you for watching, and have a great Sunday.